Hello and welcome to A Doctor's View, a podcast looking at everyday health topics and life through a doctor's eyes. Please note that all opinions are my own and should not replace the advice given to you by your own doctor. I'm Dr Bolivios. Let's begin. Hello everyone, welcome to Doctor's View. I'm Dr Bolivios. Dr Shan Hussain is an author, general practitioner, health coach, wellness advisor, and ambassador to the World Health Innovation Summit, as well as being a podcaster and radio presenter. He joins me today to discuss some of the shortcomings that we experience within the health system and how bureaucracy within our health system has changed over the years. More importantly, he shares his suggestions to solve these issues. Hello, Shan. Welcome to the show.
Hi, Paul. Great to be here. Thanks for inviting me.
No problem. You do a lot of work with helping people overcome problems with stress, and you develop mentorship programs and coaching programs to help individuals, organizations, and you've got a book, The Big Prescription, which focuses on the evidence-based holistic health practices and is a means for readers to learn about these practices and how they improve their lives. Just very quickly, I wondered how being a GP led on to this.
Okay, great question. Yes, this is something I get asked quite commonly. What I've found, so I've been a GP since 2007, so that's 12 years now. And what I've noticed in that time is that we've just been getting busier and busier. Where there's been more and more patient demand, more people needing our services. And many problems that we're increasingly seeing now are potentially avoidable and preventable. And so that's really what led me down to this route, to say, well, how much of this can we actually avoid seeing? What can we do to help people understand health from a holistic point of view? We talk about health as defined as by the World Health Organization as a state of complete physical, mental, and social well-being. And those three parameters really are what lead us to health. So, doctors have pretty much exclusively talked about physical health for most of our careers. And it's only really in the last maybe decade or two that mental health has really started to get the attention it deserves. And now we're finding social health is starting to get some attention, along with social prescribing and looking around areas where there is a degree of social deprivation and how that can coincide with many chronic diseases. So I think it's really about looking broadly at our health and what's happening around us and how that's affecting us physically, mentally, and socially, and how that shows up as illness. So, if we can find steps to address any of those imbalances in one or more of those three areas, then theoretically we will move towards health. And that's really what I wanted to help people understand.
Seeing it from a more holistic perspective, essentially, encompassing a lot of different things.
Yes, absolutely. I mean, we've all got, different stories throughout our careers of how such situations can affect our health physically. One eye-opening case that I had when I worked in palliative medicine back in 2006, and I saw a patient there who was he was very distressed emotionally, and he was pacing up and down the room and really struggling with the diagnosis and how he was feeling. And I remember he was on very high doses of morphine to help address what he felt was the physical pain that he was experiencing. So we were focusing on how we could help him from an emotional viewpoint as well. And we started complementary therapy, psychotherapy, and I believe we started some antidepressant therapy as well. And over the course of about a month, we managed to get him almost completely off his morphine, and he left feeling emotionally much better in himself. And that really opened my eyes to how emotional pain can manifest as physical pain, and what we can do if we address all areas that can lead to that. It's interesting because my father was a chronic pain relief consultant before he retired, and used to talk about this quite a lot. But actually seeing it firsthand was a really eye-opening moment for me.
That's actually quite amazing to see the difference that something like that can make, and it's lovely to hear that from a patient as well. Shan, I've been a doctor for about 9.5 years now, and over that time, I've noticed huge changes in the way we practice medicine. I've got to say, from a personal perspective, some of those are not for the better. And I was just wondering what your view on this was, and what your experiences have been over the last 12 years as a GP.
Well, I completely agree with that. I've been a doctor now for almost 20 years, and we've seen a tremendous amount of change in that time. And very few of them, in my opinion, have been for the better. And we're now seeing that, unfortunately, with a lot of doctors leaving the profession, emigrating, going off long-term sick. And, our GP numbers, as I'm a GP, that's the area that I sort of look at. They're falling at a rapid rate. I think since 2013, we've lost about 20% of our workforce, which is pretty devastating. And then if you really think about it, that means that the remaining workforce are now working 25% harder to try and meet the demand that is there. I think if we look at the trends that have happened in the course of my career, it's three things jump out at me. Firstly, that patient demand has increased. That people needing GP services and primary care services, that has increased. We haven't had a real pay rise since 2004, year on year, that whilst there have been some pay rises, they've been eaten up by inflation. So effectively, we've had pay cuts. And obviously, with inflation going up, that means that our money doesn't take us quite as far. So in essence, we're working harder for less money that doesn't have quite as much value. So that's raises a lot of problems, and maybe that goes some way to explaining why so many doctors are stressed and overwhelmed and burned out. There was a survey by the BMA done recently that showed 25% of doctors, unfortunately, have resorted to alcohol or drugs, prescription drugs, to help attenuate a lot of the symptoms that they're experiencing, which is very worrying. And
it's an incredibly high number, isn't it?
It certainly needs to get more attention.
Yeah, I completely agree. And I mean, from my perspective, the actual work side of things, even the everyday tasks that we would normally do that would take such a short time, are now taking longer and longer. And I'm an anaesthetist, anaesthetic fellow, and usually the some of the day case procedures, for example, the actual paperwork side of things, they take longer than the procedure, the anaesthetic, and the operation combined, and it adds huge amount to stress just in your everyday life. And I'm sure it's similar in the world of GP.
Yes, it is. There was a study done a few years ago. I think it was US based, but I can certainly imagine it's similar in this country, that showed that doctors spend a third of their time doing paperwork. And sometimes it's almost as if we feel that there's a lawyer looking over our shoulder as we're documenting everything and making sure that it's all, all the boxes are ticked, all the T's are crossed and the I's are dotted. And making sure that it would potentially stand up in court if, in the unfortunate event that something was to go wrong. It can really take us away from a lot of our core work. I mean, GPs, as you may well know, GPs do 10-minute appointments back to back. Maybe depends on how some workers have their clinic set up, but sometimes they have a block session just to catch up. So, otherwise it's back-to-back 10-minute appointments for whatever a surgery length is for an individual. In my case, it's 3 hours. And that is very stressful if you think about it. People coming in with an average of 2.7 problems that we have to address in 10 minutes and document everything before calling in the next patient. Yes. So there's a lot of demand there at an emotional level to really help people. And it can certainly be very, very challenging at times.
I completely agree. My one experience with GP was when I was a foundation year doctor and we were rotating around, and on my GP placement, at the end of the placement, they gave us 10-minute slots to gain an actual insight. And I must say, a whole day of 10-minute slots, it was absolutely chaotic. I just found myself sitting, staring at the computer screen, typing in everything instead of talking to the patient. It was quite distressing, and you went home really not knowing whether you've been doing the right things or not. And I genuinely don't know how you do it, to be honest, in every day, doing 10-minute slots. It's quite extraordinary, the demand there.
It's also very rewarding. I want to be very clear. That's why I still do it. There's nothing quite as rewarding as making a positive difference in someone's life. In terms of how we manage it, I mean, there's lots of different consultation models that are applicable to general practice that we don't learn about in medical school. And, different things work for different people. What I found that I think works effectively, alongside the consultation ones, the traditional presented complaint, history of presented complaint, past medical history, etc., is looking at, how we can help at an emotional level and really sort of building that connection and that trust with the individual. I spoke with a renowned therapist called Richard Nichols recently, who told me that he was talking about some research paper, found that the psychotherapists who have the best results with their clients are the ones who can build the relationship, not necessarily the most qualified or the most experienced or the ones with the most credentials. It's the ones who can build the relationship. And that's very much what it comes back to, I think, building relationships with our patients, obviously professional relationships, just to be clear, but building those relationships and gaining that trust and understanding, and that way we can work towards better outcomes.
And unfortunately, to do that, we need time with each patient,
yes,
which we're losing, I feel.
Yes, we are. I think the government's answer to these problems just seems to be, create more appointments. And, they've been saying that for years now. I think it was Gordon Brown in 2008 who introduced extended hours. And, these appointments just get taken up so much. The practice that I was a partner at back in, for 10 years between 2007 to 2017, I think we would offer something like 1,100 appointments a week. And so we tried getting more staff in and built it up to 1,200, 1,300. And those appointments just got swallowed up. And I thought, well, gosh, we could create 2,000 appointments a week. They'd get eaten up. So you can't actually really meet the demand. It just seems to almost be endless. There's got to be more effective ways of working, which is what took me towards prevention and helping people understand areas of health that they could actually self-manage and what they could do to prevent many illnesses in the first place.
Yeah, I mean, prevention is our best way of keeping these appointments more open to problems that I won't say more serious, because everyone's got their own. It's a very subjective view what's serious and what isn't, and I don't want ever to belittle someone's ailments, but in terms of things that really do need a specialist advice or specialist treatment or medications, of course. And aside from the prevention side of things, what do you think is the best way of going forward with trying to help decrease the demand and also to actually be able to spend more time with our patients?
It's interesting about why demand has risen, the potential reasons behind that. And I wonder if it's as a result of I don't want to say disintegration of community, but certainly, we don't have the same sort of communities that we used to have. I mean, when I was a kid growing up in the 70s and 80s, we knew the names of everyone on our street, and we'd hang around and we'd go out and play till dark and everything. Someone in the neighborhood knew a doctor, and there was always people that could go and just get that informal help and advice. I don't think we have that now to the same extent, and I think that has made a tremendous difference. We have families who live in our practice area, and they literally don't know anybody at all.
Yeah.
And so if their newborn baby gets sick, they don't know what to do. They don't know who to turn to. It's okay with me when I became a father, because obviously I can look out for any
Sure.
signs of illness with my son. But it's not uncommon for me to get phone calls from friends, relatives, at strange hours of the day and night, just wanting to run something by me about their son or daughter or their own health, just to get an opinion. So I think that is an element that may well have played a part. I think there's many things, Paul, to be honest,
Yeah.
that have happened over the last decade or two within the National Health Service that I think are actually potentially causing a lot of the problems that we're experiencing now. I think increasingly we seem to have a microscope over everything we do and how we practice as doctors, and there almost seems to be a vilification of doctors nowadays,
Yes.
from a bureaucratic level. When I worked in hospital medicine, we seemed to all be pulling together and singing from the same hymn sheet and looking out for each other. And the managers were great, and they were sensitive. They had empathy. They had compassion. I don't see that now with NHS England. And one of my beliefs is that people devoid of empathy and compassion should instantly be disqualified from working in healthcare. And that includes, everyone within the actual National Health Service itself. I think this is a real problem. If there are doctors that are struggling and they're going out to get help from such organizations and they're not getting it, or they're being given the cold shoulder or just being brushed off, it can have very devastating consequences about, how we're being supported. And I think what we're seeing now at the moment with the amount of stress and overwhelm and burnout, we now have doctors leaving the profession at quite a advanced rate. We've got long-term sick leave. The suicide rate of doctors is up to 4 times the national average, which is just terrifying.
It's ridiculous. Yeah.
Yeah, I mean, I think you've probably got to the stage now where former colleagues of yours may well have tragically taken their own life. I think myself, as 5 of my previous colleagues, sadly no longer with us, having taken their own life. And it doesn't leave you, when these things happen. It just kind of stays with you, like, what could I have done to help, or where did the system fail these people? And I don't know what the answer is, but I think there does need to be more sort of central support. I'm aware of doctors who are not willing to reach out for help simply because of how they may well be perceived and whether they would have their fitness to practice questioned. And that is wrong. That's inherently wrong. We've got to do more to allow people to speak up and talk about how they're feeling if they're having a difficult time.
Yes, and very recently been chatting to people and on previous podcasts regarding this issue, and it seemed to be one of the main causes of people not coming forward was that exact reason. It's as a doctor, you feel that, will I be viewed as not capable of doing my job, not capable if I failed as a doctor in general, and like you say, vilified for coming out with this problem, and it does stop a lot of people from seeking help. And I think that is something that does need to change very dramatically and very quickly within the hospital. And I think every trust should make that very clear to their staff, and I think that would actually help, and people may well come forward, doctors, nurses, and all members of staff in the hospital, because I see quite a lot of stressed out healthcare specialists or healthcare workers, and also nursing staff, theatre staff. You see them they're tired now, and they feel very stressed at times, especially when you've got busy days and you feel unsupported.
Well, I was about to ask you, actually, because I haven't worked in hospital medicine since 2007, what the actual vibe is nowadays. How are things going there?
I feel over the last few years, when I first started, there was more of a willingness for goodwill. Now, not to be taken in the wrong way, everyone who works in the hospital has goodwill, of course. Everyone wants to do a good job and to do as much as they possibly can. But I feel they've been so pushed to the limit now, everyone, that nowadays it's a case of we need extra staff for a shift. Very few people are now going to be willing to sign up for that extra shift because they've been stressed up to their limits already in the everyday job, and so doing more hours, it's just not there anymore. And obviously that's putting more pressure on the system in general, but you can't blame anyone for not wanting to do these things because the day-to-day job has just become so tiring. There's really no other option other than to hire agency staff, which is often very difficult, and you just get that sense that everyone's a little bit fed up of the whole thing.
Yes, I think it's very similar in primary care, and I was in that exact boat where I was thinking, well, I'm doing the very best I can. I'm working late. I'm doing extra stuff on the weekends and the evenings, and for what? I don't seem to be feeling valued or appreciated, or we're not getting any sort of pats on the back saying, hey, well done, you've done a good job there. In fact, quite the opposite was happening. We were getting audited because our enhanced services, we would make sure that we were meeting all the criteria there to ensure that we were getting sufficient revenue coming in to support our team. And they would question that. And so every year we would get the auditors descend upon us and just go through everything with a fine-tooth comb. And it was rather unpleasant. And when the Care Quality Commission came in, and the way they have approached general practice, I think, has been abhorrent. I really do. The disrespect that's shown towards hardworking, dedicated, committed, and highly trained, experienced clinical staff is just disgraceful. And the rate at which they're shutting down general practice without, permitting organizations to correct or, having some supportive dialogue about how organizations can improve is disgraceful. The last stat I heard was that approximately once per week they were closing down a practice for one reason or another. And at some point we're going to reach a tipping point. There's going to be a critical mass that's just going to be reached, and we're going to think, well, okay, here we are. This is the bed that we've created. Now we have to lay in it. I just think that the levels of bureaucracy and micromanagement going on is getting to the point where it's dangerous, frankly. When we look at dangerous in terms of what it holds for the future of general practice. I actually went on television a few months ago to talk about these very crises that we're discussing today, and the producers managed to get hold of NHS England to get a spokesman to comment on it. And their verbatim comment was, I'll read this out to you, new funding is ensuring the NHS GP health service is extended to all our doctors across the country. And just get the next page. This will mean the NHS will have a more comprehensive national mental health support offer to doctors than any other country in the world. That's their quote. And when I read that, it reads like a Trump tweet to me. It just doesn't really sort of ring true, and it's just hot air. Where are we seeing this? Where is the actual evidence that this is out there and it's definitely going to help people? So I think we as healthcare professionals need to insist on more from such organizations, because as the World Health Organization says, a healthy workplace is not just one where there is removal of all harmful elements, but also one that has I can't remember the exact quote, but an abundance of health promoting ones. And I just don't really see that within our profession. The NHS is the 6th largest employer in the world today. and frankly, they should carry a bit more responsibility than what they're currently doing when it comes to supporting staff.
I agree. It seems to be that all we get is an explanation as to why something's a problem as opposed to a solution to this problem. And it doesn't seem to be changing anytime soon. And like you say, you just get a load of waffle, which is just words on a page. It doesn't actually transpire into anything in practice, and things just become worse and worse. And I don't know what your thoughts are on the bureaucracy within general practice, or just within doctors practicing, in terms of keeping up their skill set. I use this term very loosely because personally I don't feel it has any actually any impact on a doctor's skill set. Things like our portfolios, e-learning, and all these things that we're made to do to continue to jump through hoops, and it's just endless and endless. And I just don't feel it actually adds anything. And in actual fact, I think it adds stress to our working environments, having to do all these reflective practices and things like that. I don't know what your take is on it.
I agree. I do want to say to our listeners that I do have some potential solutions to all this. So I don't want it to sound like I'm just complaining about the job at all. But yes, I think, when we introduced, sorry, I should rephrase that, when we agreed to allow appraisals and revalidation to be part of our professional lives, I don't think we were really explained as to what we would have to do. And we were just told this is it, and we have to do it. And it was all led by senior doctors who we assumed knew better than us. But you've got to look at the results. What is really happening? Do you feel any safer today than you did 10 years ago? Has this really sort of flushed out the bad doctors? And I would say the answer to both of those questions is no. I think if we look at annual appraisals, what are we really doing? Well, we have to take out a minimum 50 hours of continuing professional development. And then there's also the preparation and assimilation of all the material, getting all your evidence in place, and then going ahead and having your meeting with your appraiser. And you are doing all of this work for free. This is all done in your own time. Now, this would, for me, take at least a week or 2 weeks of a year. So 2 weeks a year, I'm working for free.
Yeah.
That's 2 weeks of our annual leave that we have surrendered forever.
Yes.
Why did no one actually mention that this is what we were signing up for? And, we talk about how it's supposed to make better doctors. Well, where's the evidence for that? Can we point to the evidence for that? And I always feel
there is none.
Well, in that case, we should abandon the whole process. Surely, if there's going to be some sort of massive implementation of change, then someone should come or an organization independently should come and assess how effective that change has been. And if they find that it hasn't been effective, it should be abandoned. To me, that's like primary school common sense.
Yeah. I've heard people say that actually when they look at it, it wouldn't actually stop another Harold shipment from taking place. It wouldn't actually do it. He would actually score very well in his revalidation, and because his patients actually liked him, his colleagues liked him. He was supposedly a good doctor, and so in actual fact, in hindsight, would it have helped? And the answer was probably no, it wouldn't.
Yes, we should remember that Harold Shipman was loved by his patients, but there's nothing to suggest. There's no evidence to suggest that appraisals and revalidation would prevent another Shipman case from occurring.
No, I doubt it would. And you've mentioned that you have some solutions to these problems. I'd very much like to hear them, and I'm sure everyone else would too.
Well, these are just my thoughts. My initial thoughts is I was challenged on Twitter actually by someone. They were talking about how to make things better, and someone said, "Oh, we need to sort out pensions." And and I thought, well, pensions? Who cares about pensions right now? Look at what's happening in general practice or in the healthcare. Full stop. Pensions is the least of our worries. So then he challenged me and said, "Well, what will be your top 4 things?" And I said, "Well, the first thing, and I've already mentioned this, is stop vilifying doctors. This is just getting to the point where it's just completely out of control. The number of tragic stories we're hearing about doctors doctors who it's so easy to start an investigation against a doctor. It really is. It just takes one person to make one allegation, and that's it. The ball's rolling. Chances are you'll probably be suspended whilst undergoing investigation. And, emotionally, that can put people through all kinds of turmoil. And it's almost like you're guilty until proven innocent. And this needs to change. This needs to be reversed. So that's the very first thing I want, just to stop this. I went to a presentation that a friend of mine did, who I went to medical school with. He went on to work for NHS England. He now does some personal development courses for general practitioners. He's called Dean Mercer. If you've not heard of him, he's highly worth checking out. Maybe even get him on this podcast. But he's a lovely chap, and he used to work for NHS England. And one of the things he told me in this presentation was that the patients now have all the power. Doctors have essentially surrendered all the power that they have, and it's frightening how exposed we are as professionals at the moment, and we've got to reverse this trend. So that's the first one. The second one probably follows on from what I've been saying, is really abandoning this incessant overregulation and bureaucracy that's taking us away from patient care. It's just we talked about how that can affect your anesthetic list, and how much of it is really necessary, and how much of it could be avoided. And if we could just get one extra patient onto your list every session, then that's 100 more operations done every year, maybe more. I'm not sure how often you do your list, but that would be a massive step forward. And then reinvesting all the savings from that into work streams that would promote population health through education and support, looking at diet, helping people look at lifestyle factors that contribute to so many chronic conditions. We have a situation now where life expectancy in the UK is stalling and falling, and depending on which parts of the UK you go to. Chronic diseases are rising, and we've now got more medications than any time in history. Yeah. So something is not quite worked out there. Why aren't we living longer? Why aren't we living better? Why aren't we feeling happier and less stressed? So looking at how we can promote population health through whether it's educational events, supportive events, one-on-one mentorship, and this can all be done through the National Health Service, I believe. And we're starting to see some of that through wonderful initiatives like social prescribing. A good friend of mine, Mohan Sekram, is helping and doing some great work there down in Merton in London, and Poonam Krishnan in Glasgow as well. So I think that has the potential to go a very long way. And fourth, and maybe the final, perhaps most important one, is place staff well-being at the heart of healthcare delivery. If we're going to be asked to work an extra shift, and we say, well, are you feeling all right? How are you, Paul? How are you feeling today?
Yes.
How has your week been? What's been going on? They've started to introduce short sward rounds recently. I'm not sure if you're familiar with them.
No.
But they have the potential to really help make a difference with a lot of healthcare professionals, where groups of doctors and nurses and all healthcare professionals can actually sit down together and just talk about what's happening, and talk about how they're feeling, and how it's affecting them. Really getting that mentorship and support, and just knowing that we're not in this alone. We're in this together. And like I say, we're the sixth largest employer in the world today. There's so many of us, and there's help available if we are struggling. So it's really about taking that help, asking for that help that is available to us, without shame or without fear of judgment or fear of repercussions. And I think it's that latter one that needs to be addressed, the fear of repercussions, and what could potentially happen if we speak out and talk about how we're feeling at an emotional level.
Thank you, Shan. All incredibly sensible and logical points there. Definitely the last point, especially over the last few weeks, that become a bit more involved in this and chatting to people about it. It definitely seems to be the one that's hit home, and would like to make a point for any doctors, medical professionals listening to this, that they can seek help without fear. And it's the repercussions of not doing so we've seen from history, and unfortunately it's continuing, are devastating for everyone involved. And so, no, thank you very much for those points. On the note of us losing power, I think that goes beyond the staff, beyond patients and staff relationships. I think it's actually going beyond that into managers and people who, like you said earlier, don't have any clinical knowledge, clinical experience. And I think that's having a big impact too. I don't know what your thoughts are.
Yes, I agree. I do have a major issue with senior managers, bureaucrats, and failed doctors telling us how to practice medicine. And we are seeing that increasingly now, and the introduction of guidelines and tick box exercises and protocols, policies, pathways, and procedures, again, which have very little scientific basis behind them. And you know what? I just wish I had a year off to really go through all of them with a red pen and break them down and say, actually, you know what? These are all absolute nonsense, and here's the evidence why. Yeah. But unfortunately, I don't think it would change anything. I don't know if there's some sort of hidden agenda here. I'm not a conspiracy theorist, but what I do know for sure is that something needs to happen to address the overwhelming levels of stress and burnout within the profession.
I was actually going to ask you what your thoughts are on the solution for the bureaucratic changes and the managerial changes, but you have actually just told me. But
get rid of them. Get rid of them all. You know, but we can see the numbers. We can see the what's been happening. You know, the inception of NHS England, April 2013. Since that, the number of GPs was rising up until that point, and since then, year on year, they've been falling. It could be a coincidence, but then again, it could be a cause and effect. So, you know, I haven't had a single positive interaction with NHS England in my career. And I'm quite happy to go on this podcast and say that.
That's fair enough. Yeah. And finally, Shan, do you think over the years patient expectation has changed as well? And dare I say, respect in some regards, say from difference between the older generation and the newer generation? And is there anything we can do about that?
That's an interesting one, Paul. I think it's probably very much dependent on where you live and what society is like in that area. I think, if we go back to my dad's days when he was a doctor working in the 60s, and doctors were worshipped and, respected, and everything was fine. I remember, in fact, one of my first jobs, there was a senior nurse working there who told me that when she started nursing, this was back in like the 40s, 50s or something like that, crazy years ago, that prior to ward rounds, all of the patients would be in their beds and all of the notes would be out on their beds, and the nurses would be standing to attention, and then the doctors would show up smoking their pipes and do a ward round, and everyone was in fear of them, and they would do the job. And things have certainly changed quite dramatically, and I think quite rightly, that's not the way things should be at all. I think we've got to remember that we're doctors, we're human beings. I don't expect to be getting any special treatment. I don't even go by the title doctor.
Sure.
The only time I insist on being called Dr Hussain is if I'm being addressed by NHS England. But my patients, I ask them to call me by my first name, because there's a barrier to communication, and I don't want them to feel that they can't talk to me. It's really important that they understand and feel that sort of human interaction and connection with between the doctor and the patient. In terms of respect, I think I've always felt respect is earned, and I think if you have a manner where you show kindness and consideration and compassion and empathy, then you're heading on the right track. There'll always be some patients who will never respect you no matter what, and that's absolutely fine. Maybe I'm not the doctor for them. Maybe they decided that they don't want to respect me, and they sooner respect my colleague working in the next room, and that's absolutely fine. That's the way it is, and I accept that.
That's a good point, actually. That's fair enough. Yeah. didn't look at it from that perspective. That's no, it's very fair to say. Shan, thank you very much for coming on to the podcast, and thanks for sharing your thoughts on the way that you feel that the health system is not working as at the moment, although you've come up with some very, very valid solutions. I just hope the powers that be are listening to this and can actually take some heed from it and actually take some advice from it. And hopefully, maybe one day things will improve.
I hope so too. I think, we're coming up to election time, and we're getting a lot of promises from all parties right now talking about how they're going to make the NHS better. And I do feel that the answer is not about just endlessly throwing money at the organisation. I think there are some constitutional changes that can happen within to make things better very quickly, and really just show staff that you care about them. And, as Richard Branson famously said, if you take care of your staff, they'll take care of your clients. Similarly, if we take care of our colleagues, then they can take better care of our patients.
A lovely sentiment to end the show there. That was Dr. Shan Hussain, everybody. If you do wish to learn more about the natural approach to sustainable health, I will leave links to his website on my podcast description. And also, if you want to listen to Dr. Shan's podcast, I will leave links to that too. That's it for this week. If you do enjoy the show, please do leave a review on iTunes or Podchaser or any platform that you do listen to. And if you do have any questions or any topics that you'd like me to discuss in the future episodes, please do email me at doctorsview@gmail.com or visit my website at doctorsview.uk. As always, please look after yourselves, and I'll join you again next time. I'm Dr. Bolivios. Goodbye.